Good afternoon for Wall Street Media. This is Ekaterina. I'm here with Doug, and we'll help you to make money in the stock market with information you can't find anywhere else.
Hi, thanks for coming back in.
Hey, my pleasure. Always my pleasure.
Yeah, you're a star. Our elevators are down today. She says, I'll come in and walk, right? Wasn't going to kill you, huh?
Yeah, it's a good exercise, you know?
You're super fantastic.
8 flights of stairs.
Yeah, fantastic.
And then do the recording. Great.
Thank you very much. That was very nice.
My pleasure. Always my pleasure, Doc.
And we have videos?
We do have videos.
What do we have?
We have Timothy Gurtin, President and CEO of Varian Medical Systems, ticker VAR, talks about X-ray products and the Toshiba deal announced this morning. Let's see what we have.
Okay.
Switching away from oncology and going to X-ray products. X-ray products produces those little panels that you see on the right as part of our flat panel business. Film is going away in medicine, just like it's gone away in for cameras that you use at your home. People want to be able to take these kinds of images, even though they're more expensive. For the simple right now, they're more expensive, although not per image. But the reason why they're more expensive, but still desirable, is that you can take a picture and you can see it right away. You know whether you got it. I don't know how many of you have seen X-ray images of yourself or family members that were done where they took the image and they went away and said, no, we need to repeat the X-ray. That process is gone with these imagers. Also, you can image, you can take images of while you're rotating around the patient. So you can actually create CT scans using these devices, and so they're kind of the ultimate in multi-slice CT scan. And we took this technology and we applied it to the oncology business, and we're able to actually take in 1 minute a CT scan of a whole volume of the patient, and that's part of how we position people. So that was an example of how this particular product that was used in this or created in this one business unit was used across the company. It's this business unit has had some pretty fast growth, 13%. Most of that is in the flat panel business, although we did have a remarkably good year last year in the X-ray tube business. And I think we just announced that we had a renewal of our Toshiba contract, and they've added in some new tubes, and so we have a very good relationship with Toshiba that I think will go on for many years to come. We've introduced a number of new panels, radiographic panels introduced this year. Our customers are now incorporating those in their products. We expect to get a little business from that in 2008 in terms of shipments, and most of that business in 2009. And also we're looking at mammographic panels.
Hey, thanks to you and Tyler for that one. Super interesting stuff. And these guys are up almost 3% today. So everyone must have liked their presentation quite a bit. And, you know, of course, the news about the Toshiba deal.
Yeah.
You know, pretty interesting stuff. When I was just at the dentist like 2 weeks ago, that's what they used, is that kind of a thing.
Yeah.
And it cuts down, you know, you don't have that wait for film afterwards and, I didn't get the shot that I wanted or anything like that.
You have to go back to them if they want to redo it, right?
Yeah, well, pretty neat, you know. Now, you know what I would like to know? And I'd be interested in knowing this because we did a conference in Monaco, a healthcare one a couple weeks ago, and the guy was talking about that in 10 years, 1 in 50 cancer cases he thinks will be from X-rays and CT scans.
Oh, really?
And I wonder if these cut down on that, on the X-rays.
Well, maybe.
Yeah, I'd like to learn and listen to that. You know,
yeah, we should
I get hurt a lot, so I wind up with a lot of those. I don't think that, you know, that concerns me quite a bit. Good stuff, though. On a day where the Dow's down 1.7% and the Nasdaq's down 2.25%, these guys are up 3%. So good news. Nice work. Thank you.
Good news. My pleasure. I have one more for you guys.
Okay, let's see.
Dr. Thomas Akarma, President and CEO of Geron Corporation, ticker GERN, talks about embryonic stem cells. We're here to watch it.
Let's take a look.
Turning to the embryonic stem cell side, our first and most advanced program is against spinal cord injury. The hallmark of our programs on embryonic stem cells begins with a thorough understanding of the pathology we are trying to reverse by the injection of the repairing cell directly into the tissue that is damaged. And it's no better illustrated than spinal cord injury. This is a cartoon of a human spinal cord injury. Contrary to most people think, spinal cord injury is not a full thickness severance of the cord. It is a contusion or a bruise. There is a zone of necrosis or a cyst that does destroy some nerves, but the primary pathology are nerves that are still intact but are demyelinated. There's no more insulation around them. And that's because the glial cells, which produce this insulation, are very sensitive to the inflammation that occurs in a spinal cord injury. So with that knowledge, we learned how to make progenitors of glial cells from human embryonic stem cells. And these are the cells that in the normal spinal cord myelinate or insulate the nerves. Without myelin, there's no nerve transmission. So what this therapy proposes to do is resupply to the injured cord precisely the cell type needed to engineer the repair. So in collaboration with Hans Kierstead at UC Irvine, we've learned how to make these cells scalably from embryonic stem cells. And when we put them into animal models of spinal cord injury, we have dramatic clinical improvement. Animals go from pulling themselves with their front paws, dragging their tail and hind limbs in the cage, to having almost normal locomotion with their tail above the cage floor.
Nice work, Tyler. Thanks for that one. And thank you. These guys, that's our second one from Needham, but we have tons and tons of notes and highlights for them today. What do you have for us? What else happened with Needham?
Let's see what we have. We have Keith Bryant, Head of Corporate Development for Arena Pharmaceuticals, ticker ARNA, discuss lorcaserin and its promising use to treat obesity, as well as the drug in development to treat insomnia.
Oh, boy.
That's a useful one.
Well, you look over here when you say that's a useful one.
Well,
About insomnia.
Not applying anything to remark.
Although, we really should have had Tyler get a business card for me, and I could have signed up as one of the test patients.
Yeah, they even pay for it, so maybe you should.
Yeah,
Some
maybe I should anyhow.
Extra cash money.
Yeah.
And good night's sleep. It can be better. And another news.
Yes, and another neuse. She's a nice girl.
Dr. Yuli Hexel, CEO of Acadia Pharmaceuticals, ACAD, talked about pimavanserin used to combat schizophrenia and Parkinson's disease psychosis. It has shown an enhanced efficacy, reduced side effects, and has caused fewer patients to experience significant weight gain.
That sounds like a winner too, right? And these guys are up today. Yet again, another one from Needham today that's up a little bit on a day when all the stocks, particularly my stocks, all collapsed, Nice one.
Yeah, it is. Dr. Charles Randall Mills, President and CEO of Osiris Therapeutics, ticker OSIR, talked about the $225 million government contract with Genzyme for an anti-chemical weapons contract.
Boy, I'll tell you what, German Mike, we should have either sold in May and went away, or sold in May and bought all the Needham companies. These guys are up 1% today, too.
Yeah, that's pretty good.
Yeah, you're good luck, John.
For them.
Yeah.
Stephen Angle, Chairman and CEO of XOMA, ticker XOMA, spoke about the recent data released in the American Diabetes Association's scientific conference involving XOMA's study 052 of animal models in diabetes and the reduction of cholesterol.
Yeah.
It's a useful one.
It's really great, right?
Yeah.
All of the biotechs and the pharmaceuticals and stuff are starting to really come through.
Yeah.
I saw a study. I saw something today on Yahoo News that said the average German. We were just talking about this. The average lifespan for an American now is 78, and they said it's because they're able to treat so many diseases that used to be terminal. And it just sounds like when we do these conferences, I always get so excited, and optimistic. It's so nice to hear that they're getting closer and closer to be able to treat so many nasty conditions and diseases, right?
Absolutely. Yeah.
Fantastic. Great both for people and for investors.
Yeah.
I'm holding on to Aspen Bio, waiting for them to get approved for the appendicitis, so that all the people don't have to get that awful test or get sent home or otherwise. And so many of these guys, I need to go through and listen to these and see which one of these I need to add to my portfolio as well.
Oh, yeah, you should.
Thanks very much for your help today.
My pleasure. Always my pleasure, Doug. We are here every day at Wall Street Media. You can find us directly at WSMCO.com. Thank you.